My name is Allison Johnson. I'm a health educator with the Navajo Special Diabetes Program here in Winter Rock, Arizona. Today I'll be presenting on probiotics. So what are probiotics? Probiotics are known as live microorganisms. They have the potential to restore gastrointestinal tract to a healthy state or equilibrium. And they also have the potential to control blood sugar and lower the risk of diabetes. Probiotics can be found in yogurt or dietary supplements. So this can be a pill form, a liquid form. And so the picture I posted here is of a liquid form of Good Belly. And this is a probiotic drink. And probiotics can also be found in other fermented foods like kimchi and sauerkraut. The next question I have for you guys is, how do probiotics work? So before we can understand how probiotics work, we must understand how the gut works. So understanding the gut includes your mouth, your throat, your esophagus, all the way down into your stomach, your small intestines, your large intestines, your rectum, and your anus. But today we'll be focusing more on the involvement of the small and large intestines. But overall, what the gut helps with, or the gastrointestinal tract helps with, breaking down food, absorbing the food and nutrients that you're getting, and basically the body's using it for daily functions. Going more in depth from the small intestines and large intestines is something called the gut microbiome. The body is made up of bacteria, viruses, fungi, and other living microorganisms, which create the microbiome. So the microbiome is found in your intestine, but sometimes in your skin. What the microbiome has is something called good bacteria. The good bacteria have different roles and effects on your body. One of them can be enhancing your immune system, helping with heart health, your weight, and even your emotions. So the key component here is the food you eat affects your bodily functions and influences your overall gut health. So when you're first born, you have bacteria already in your body. And so what this bacteria does is to help digest the healthy sugars that you're getting from breast milk. And this is important because it helps with growth for an infant, for a newborn. And bacteria also helps with digesting fiber, helping control the immune system. So this means how the body responds to an infection. And bacteria also helps with helping control your brain health. So with that being said, like the bacteria that's already found in your gut, probiotics are known as a good bacteria and can add to the bacteria that's already in your intestinal tract. So again, they all have different roles, and so does probiotics. There's not just one type of probiotic, and they have different effects on your body. And so they can help with maintaining a healthy community of microorganisms. So like I said, there's bacteria in your microbiome. And so what probiotics can do is help regulate the daily functions of bacteria that's pre-existing in your gut microbiome. And probiotics also have the function of regrowing or returning your body's bacteria to a healthy condition, also known as equilibrium. So again, just making sure they're regulating properly, they're functioning properly. They also have an influence on your body's immune response. And then the last one being normal GI functioning. So this can be helping with gastrointestinal distress. Whether you're bloated, you might be feeling constipated. This probiotics can help with that in regulating normal bowel movements. And so moving on, now that we've discussed what your gut health is, how the small intestines and the gut microbiome play for your overall health, we'll talk more about probiotics and diabetes. And basically, there are studies that show that probiotics have a positive impact on metabolic control of individuals with type 2 diabetes. And so what this study looked at was the effects of probiotics on a person's A1C levels, insulin levels, cholesterol, and their blood pressure fluctuations. And what they did find was that probiotics help maintain all of these levels in the body. And then another study was done on 80 individuals. Of these 80 individuals, there were 15% that were diagnosed with prediabetes. And so what this study had done was they took a control group of having these individuals consume a DASH diet, and then another group consuming the same DASH diet, but incorporating probiotic-rich foods as well. And so what this study found was that the individuals from the DASH diet plus the probiotics, they were able to lower their A1C by 8.9% compared to the control group who were strictly on just the DASH diet alone, and they lowered their A1C by 3.4%. And so the key component to this, to managing your diabetes, is to understand that you must also manage your gut health. So poorly managed blood sugar levels, insulin levels, A1C, all of that, if you're not managing that, this can impact the bacteria that's in your gut, resulting in poor gut health. And going back to how your gut health helps with your body, there's the immune system, the immune response, feeling constipated, having irregular bowel movements, your heart health, your weight, your emotions, your gut health plays a role with it. So trying to understand what you're putting into your body has great effects. And it's better to understand this to help manage diabetes. And so continuing on with managing your gut health, another way is to eat a diverse range of foods. So this can include fiber like beans, fruits, vegetables, consuming fermented foods, like I said, kimchi, sauerkraut, and then limiting artificial sweeteners. So if you like your coffee with sugar in the morning, try some alternatives, honey, or even with honey with your tea, lemon, cinnamon. There's different alternatives that can help with your diabetes management. And then consuming whole grains. Whole grains can include quinoa, whole wheat pasta, brown rice, and oats. And what whole grains can help with is releasing a steady amount of sugar into your bloodstream. And so this can help with low blood sugar, high blood sugar levels. It'll keep it steady, and this can lead to better blood sugar management for diabetes. And the last one is taking a probiotic supplement. Like I said, you can find it in fermented foods, your yogurt, dietary supplements. You can use the Good Belly drink. There's several alternatives, or even a pill form. but just understanding what type you want is important as well. And so if you want to take probiotics and you have an underlying health condition, consult with your healthcare provider first. Anyone with a serious underlying health condition should be monitored closely while taking probiotics. Some probiotics might have sugar in them, and so it's just best to understand your options and being able to regulate your blood glucose metabolic levels during this time. So with that being said, thank you everybody for listening and have a good day.